Hi. So I was just watching a video a few minutes ago, and I'd realized that I haven't had a video on myself and what it was like to have my gallbladder removed. So before I had my gallbladder removed, I went to the ER and I was having severe pains. I guess I don't remember the details, but I had some x-rays, and the ER physician had recommended to this gallbladder surgeon that I should have it removed. And so I waited several months later. I didn't seem to have another episode or any problem at that time, but the ER doctor said that I could have a spasm, or I could, the gallbladder could move. And it would be like, I guess, I had kidney stones, a couple of kidney stones in my gallbladder, and so that would be a painful thing if that happened. But he said it also could just stay there for the rest of my life and not move at all. Anyways, when I finally went in to meet my surgeon, he didn't question the ER doctor when he said I needed to get the surgery. I waited a couple months, and then I went in for the surgery. I definitely had some anxiety regarding the surgery. I was concerned about what I was reading online, saying that after the operation, after being put down by, after I was being put to sleep with the gas mask, that I could wake up very nauseous for a day or two. That frightened me more than the actual surgery itself, but I was told that it was a laparoscopic procedure. I think unnecessarily, I was frightened more by what the surgeon had told me when he was giving me numbers, saying 1 in 20 chances that something could go wrong and that I'd have to stay in the hospital longer than those 4 or 5 hours. The 1 in 20, how did I know if I was number 20 or not? And so I think that was something that maybe he could have kept to himself and just, said everything should be all right. It was some added anxiety that I didn't think I deserved to hear, because I found out that surgeons are number guys. They don't usually see waken patients. Usually the patients are lying there asleep when they come in, and they don't get to see or know the patients very much other than that. So they go by a number game, and that it wasn't anything personal. Anyways, caused a lot of anxiety. But when I went in, the whole team had their little part to do with me. When I went in to get triaged, it was really quick. Then they put the bracelet on me, and then I went into a back room, and there was a whole bunch of curtains and beds stacked up against a wall, and then another wall. So that's kind of what it looked like. In the middle was for the nurses, with all the drawers and equipment and triage stuff or doctor stuff or blankets and whatever stuff that they needed to take care of the patients once they come out of the operating room. And so that's kind of what it looked like. It was a whole bunch of curtains on both sides. Wasn't very noisy at all, to say the least. But anyways, the nurse came in first, and then I waited for I had to be there 2 hours early, which I found was a little ridiculous. And that was not for my benefit, but just in case the surgeon got done early or had a cancellation, then I would be right there. So my time wasn't as precious as his. And anyways, so that was great. So then after that, after about 20 minutes before my surgery time, which was at 2 o'clock, the what do you call him? The guy that puts the anesthetist came in and asked me a few medical questions, and then after that, one of the operating room nurses came in and said, "We're going to surgery now." And she said, "You've already met the team." When we got to the room, they had me walk, and I had the IV in my arm. I think I had something already. I don't remember if I had something hooked up to my arm or not. Seems foggy now, but I might have, with the roller thing or whatever. And I walked to the operating room, and it was like, kind of looked like it was metal all over the place. And on the right side, there was several doors. Like I can remember at least 3 operating doors with operating rooms that are probably busy constantly, day and night, every day. And so walked into mine. It was very sterile, very clean. There was like a metal table. It had all the blankets on there and ready for me. When I walked in, I was asked to get on the bed and lay down. And then the anesthetist, I didn't know, he said, we're going to do this, 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 and this. And then the surgeon walked in for about 2 seconds and said, "I'll take good care of you." And then he walked out. He already had his scrubs on, but no mask or anything. He just had his hat and his scrubs. And then they put this gas mask on me, or this mask. And at first, I didn't smell anything. It just kind of smelled like oxygen. And then it literally did smell like gasoline that you put into a car. And I thought I was going to throw up for about 2 or 3 seconds. It didn't have me counting down at all. And next thing I knew, I was awake in the other room. So I guess I did come around after the surgery, which took about, I think it was, they said 40 minutes or something for the surgery. And they did do it laparoscopically, and there was no complications. But I had 1, 2, 3, I had 3 little like incisions in my belly, and there was also a bigger incision under my belly button because I had an umbilical hernia, which means I had like a bubble or a bump that was sticking out quite a bit and covering half of my belly button. So he actually took care of that as well, because he needed to do that in order to get inside my belly button, because that was one of his tools had to go in laparoscopically. So anyways, I guess I looked really tired and weak. But then when I woke up from the anesthesia, I remember there was a nurse beside me, and I have severe post-traumatic stress disorder. So when I go under and I wake up, I go into extreme screaming fits and hitting fits, and I can't control myself or stop. But this one was worse than ever. And all I remember is telling the nurse that I need to see my doctor. I need my doctor. And the doctor, I remember his voice saying, "I'm here." And then I remember calming down within the next 2 minutes after he was there. I don't know if they gave me anything or what it was that calmed me down, but I told them I couldn't stop. I couldn't control myself, and I was hitting the side of the rail, and I was screaming at the top of my lungs, and I was crying, and I couldn't stop. And all I remember hearing on top of the doctor's voice saying, "I'm right here," was a nurse saying, "Oh my God." I started calming down, and then I went into a deep sleep for the next 3 or 4 hours. When I finally came to and started sitting up, I was very weak and dizzy from the gas, and they have to try and get you up walking as soon as possible so you can go home. They said they kept me there for a few more hours because the nurse said, "You look like you were sleeping so soundly, we just let you sleep." I had bandages all on my belly, all around, and one underneath my belly button, one to my right side, about 4 inches out, and another one on the top, just under the breastbone, like about 2 inches, another insertion where they inserted something there. So there's like 3 tools. When I tried to walk, I was very tired and weak, but I remember getting up and walking into the washroom, and that was fine, but I was very white and pale. And then my husband came to take me home, so I had to get dressed, and then I went home, and I was supposed to take it easy for the next couple of days. So that went pretty effortlessly. It was after the first. It was the first week after surgery that I started having difficulties. So the first thing that happened was I had to go. I had to go to the ER because my upper chest was hurting, and I was having like I didn't know, something was getting to me and bothering me, and I wasn't feeling well. I was feeling very nauseated and sick, and I knew something was wrong. So I went in and said that I was having some difficulties with my upper chest. And so a nurse came immediately after the triage when I arrived in the emergency, and I was put into the biggest room, the special room, immediately, and I was monitored, my chest and heart and everything right away. They thought I might have had a blood clot or something of that matter, or anyways, when the doctor came in, a nurse kept coming in every half hour asking if I was all right and what I needed. And then when the ER doctor came in and asked what I needed, I told him that I was very dehydrated and that I felt very nauseated and sick and that my chest hurt. And so he asked for a shot in my belly to make sure that that I didn't have any blood clots. And he also, to help, I guess, liquidize the blood clots or whatever, if there was anything of that nature going on. And he also asked for me to get an IV drip so I could get fluids, saline to help hydrate me again, and at the same time set me in for a CAT scan to make sure that everything was fine, CT scan, and all of that was done in about 3 hours. And then they sent me home. Actually, I believe that night they sent me home, and I had to come back the next morning to do the test, the CT scan, because they don't do it throughout the night. So yeah, that's what I did, and that was fine. So when that was all over, I felt 1,000 times better, and I went home. And then a week later, then the next week, I got sick again, and I had to go back into the ER. And this time, I went in thinking that I'd be taken seriously like I did the first time, but I didn't get the same kind of help that I had the first time, and it was different. So the second time around, they thought there was something going on with my chest. They didn't know what it was exactly, but it turns out that it was, I believe it was pneumonia. I had a bit of pneumonia going on in my chest, and so I had to go on to antibiotics for a week. And they had stabilized me as best they could, and I did get some rest, and then I went home the second time around. So I did have complications with my upper chest and my side area for a good 4 weeks after the surgery. Eating wise, I couldn't eat much at all for at least 4 weeks after. And now I find that, yeah, certain foods that I eat, I find that I'll have a bowel movement almost immediately after. A lot of times, if I eat a lot of liquidy foods, I feel like my belly like is a big balloon, and like I'm blowing it up, and it feels like a hard bowling ball, and it's really uncomfortable, and I feel sick, nauseated, and I usually have to lay down to sleep for at least an hour after I eat some foods. So that sucks. And seem to be more gassy than usual. I never was as gassy before my gallbladder was removed, and very sensitive to what I eat and drink. If the drinks are too citricy, I can't handle them as well as other things. I go through extremes where I'm not really craving water at all, and then other times feels like I can drink a gallon. Exercise-wise, I seem to have more energy. I don't have as many more stomach aches anymore, but when I do have bowel movements, they seem to be way more painful for me. I don't know if it's because of the gassiness or what that's going on, but it seems to be bothersome, and most of the time I feel all right. So, yeah. Complications, yes. Obviously, I'm more sensitive. A little bit of bile will leak out constantly because it doesn't have the gallbladder anymore, and so they don't actually attach that to, like I thought they were going to, like my large intestine or whatever. I thought they would attach it to some other part in my body, but the bile actually leaks out into your system, into your body. And some people are sensitive to that, and they feel nauseated by that. And I'm one of those people, so, I've been feeling that. And so my doctor said there's some kind of enzyme or some kind of salt-based stuff that I can take to help absorb the bile. But everything that I told him that I was going through, he was saying normal, normal, normal. And he says, I don't understand patients that say they don't feel any changes after their gallbladder is gone, because he knows and said that there's a lot of things that happen after the gallbladder is removed, and that he did assure me that my body will adjust in time with food and be able to handle and tolerate all of this stuff in time later. But it all takes time to get used to not having that part of my body or system. And so am I happy I got my gallbladder removed? Well, I went through a lot of shit and a lot of suffering and a lot of pain and discomfort and a lot of nerves and anxiety. But at the end of the day, it's over, and, I wouldn't really wish it upon anyone. And even the nurse, after I got out of surgery, said, my friend nurse is about to go in next week to get her gallbladder removed. Can you tell me what it was like? And she worked there, and she didn't even know. She wanted to know, is it painful? Does it hurt? And then she was actually telling me that gallbladder surgery is one of the worst surgeries to have and the most painful, even if it's laparoscopically. So, they were telling me, oh, no, nothing to worry about. And it's actually very, not invasive at all, and all of that crap. And so that's great. So the nurse herself told me that it is invasive, and it is one of the most painful surgeries. So, yeah, isn't that great? If you need to get it out because you get sick, then you need to get it out, and you'll survive, because I did. And everything that possibly almost could all completely go wrong, or, how I felt like shitty, like I did. But I got through it, and you will too. And as of today, cereal's hard for me. So if there's a lot of milk in my cereal, I get really full, and my stomach feels like a big balloon, like you're blowing my stomach up, like it's one of those punching balloons. That's what it feels like on the inside, and very uncomfortable. But most meats and most things I can eat and tolerate, no problem at all, but I don't eat as much as I used to. So I heard in another video that somebody said that the bile that goes into the body or whatever, and having your gallbladder removed, that we can gain a lot of weight because of having our gallbladder removed. But I had a friend who had her gallbladder removed, and she didn't become overweight and obese. So I don't know if it's a little different with everybody, but that was my experience so far, and I'd never want to go through it again, quite honestly. was very painful to walk for several days, and I couldn't lift anything for up to 6 weeks. So lifting garbage, I had to kind of, in week 3, even close to week 4, I would drag the garbage bag because my husband would only tolerate me being sick for so long, and it was like, I have duties and I got to have shit done, and he didn't understand that I couldn't lift anything. I wasn't supposed to. I could rip stitches, but whatever. So I did the best I could, and dealt with all of the shit that I had to deal with in order to get better. So that was my gallbladder surgery, and that's my story, and I'm sticking to it. So it's not the end of the world. I'm here, I'm alive, I'm well, and moral of the story would be, don't be afraid to reach out in emergency. If you're not feeling well, you got to listen to your gut and listen to your body. It'll tell you if something's wrong. Let the experts and the professionals figure out what exactly it is that is wrong. All you need to do is go in and say something's wrong. So that's what I did. The second time I went back to emergency, that's right. When I went the first time, the nurse said to me when I went home, if you have any breathing problems, at all in the next few days, come right back to emergency immediately. And so that's what happened. I started having breathing problems. I was having a hard time breathing and walking. And that's when I went back because I knew something was wrong. And that's how they found the pneumonia. So, listen to the nurses. They know what's what. Anyways, so that's what happened to me. And I got through it. And for the most part, I'm feeling really good. The last 4 days, I've been very energetic and getting a lot of stuff done around my home and feeling healthy. But when I get tired, I get real tired. So that could be a whole other issue than the removal of my gallbladder. So I'm about to close the book on this gallbladder surgery thing. Because it was around Christmas break, the 6 weeks, I haven't seen my surgeon yet for a post checkup, for the 6-week checkup, but I've got to write all this down before I forget. So if he asks questions, I can answer them, and I go see him next week, and then I can finally put this whole gallbladder surgery behind me. So anyway, that's what it was like. Listen to your body, listen to your instincts. And reach for help. Don't wait for something to get really serious or really bad. I could have got much sicker if I didn't go in and ask for help. So I caught everything right away in the very beginning stages, and I had no problems getting better because of it. So listen to the nurses. Take care of yourself. And if you need the surgery, you'll get through it just like I did. We all get through it. And sometimes you have to just trust the professionals and go in and get something like this done. So, it's one of those things, right? You get rid of one problem, you seem to get like 3 or 4 new ones. What can I do? You can't have one without the other. I suppose you can't have lightness without darkness. You can't have good without bad. So you can't have ugly without pretty. So, it's just another one of those things, right? I have to deal with a lot of new things now, but at the same time, don't worry about my gallbladder anymore.